From the left adrenal, slide in a zigzag pattern toward the urinary bladder. The purpose of this zigzag pattern is to cover the left caudal abdominal quadrant. If you did not get a good measurement of the intestines while examining the spleen, this is another chance to get one. You should also be examining the ultrasound screen for lesions of the colon or intestines, abdominal effusions, or enlarged mesenteric lymph nodes. We will use a 16-pound cat to find the urinary bladder. Remember to keep the organ centered on the ultrasound screen to reduce artifact. This is best accomplished by holding the transducer perpendicular to the patient's body and the organ of interest. Adjust depth to fill the ultrasound screen with the organ of interest. If needed, adjust transducer frequency for the current depth. Adjust gain for the best image. And adjust focal points to the bottom of the organ of interest. Remember to keep one finger of the keyboard hand on the freeze button, ready to capture the best image. When you press the freeze button, practice leaving your transducer hand relaxed and in position so that when you unfreeze, you will still have the same image. This will save you time and effort. When finished with the left adrenal, begin sliding the transducer in a zigzag pattern toward the ventral midline in a sagittal position. From the ventral midline, reverse directions and slide back to the left lateral side. During the zigzag pattern, the transducer is moving slowly and steadily caudally toward the urinary bladder. You should reach the bladder in 2 or 3 passes. Once you obtain a long-axis view of the urinary bladder, adjust depth to fill the screen with bladder. Reduce gain in the area of the bladder to reduce artifact. Fan the transducer to the patient's right side till the bladder disappears. Then reverse directions and fan to the patient's left side till the bladder disappears. Return to a long-axis view. If you could not fit all of the bladder on the ultrasound screen, slide the transducer caudally and fan left and right to see all of the bladder. Always examine the bladder in 2 views. Rotate the transducer to a transverse position and slide rapidly cranially till the bladder disappears. Then slide slowly caudally, keeping the bladder centered on the ultrasound screen. When the bladder disappears, rotate the transducer back to a long-axis view of the bladder. The wall of the urinary bladder usually appears to have 1 or 2 layers and is evenly thickened. The contents are anechoic. Look for thickening of the wall, masses, polyps, stones, or crystals. Examples of these lesions are shown in the urinary bladder and prostate DVD. The descending colon is usually to the patient's left side of the bladder. However, the colon can also be to the right side of the bladder or dorsal to it. The caudal aorta is dorsal to the bladder and to the patient's left. The caudal vena cava is dorsal and to the patient's right. If the patient is an unspayed female, the uterus and cervix are dorsal to the bladder. In male dogs, the prostate is caudal to the urinary bladder. The urinary bladder is filled with anechoic urine, and side lobe artifact is common. Reducing gain in the area of the bladder helps to reduce or eliminate this artifact. When filled, the wall of the urinary bladder is evenly thickened and less than 2 millimeters thick. I usually measure the wall only if the bladder is filled and the wall looks too thick or is unevenly thickened. The normal bladder wall becomes very thick when it is contracted and empty. It is best not to base judgments on an empty bladder.